Hi, I'm Dr. Stella Lee. On behalf of my co-authors, I'm pleased to present the findings of our study. We explored treatment burden and healthcare resource utilization in patients with chronic rhinosinusitis with nasal polyps, hereon referred to as CRS with NP. Oral corticosteroids, or OCS, may be prescribed for patients with CRS with NP when first-line treatments fail to adequately control symptoms. If OCS does not sufficiently control disease, functional endoscopic sinus surgery, or FES, may be indicated. While FES can provide lasting disease control, symptoms often recur. Our study aimed to compare the burden of OCS in patients with CRS with NP who underwent FES versus those who did not. Cost and healthcare resource utilization were also assessed. We identified and performed propensity score matching on eligible patients with CRS with NP using data from the Optum US Claims database from 2011 to 2021. OCS burden and healthcare resource utilization were assessed over 3 periods: baseline, the 365 days pre-index, intervention, covering the index date to day 44, and follow-up from days 45 to 365. Cumulative OCS dose during follow-up was 18% lower in patients who had FES compared with patients who did not have FES. During the intervention period, OCS use was higher in patients who underwent FES than those who did not. Interestingly, similar proportions of patients used OCS during follow-up, with around 1/3 receiving OCS in each group. Healthcare resource utilization differed between groups. Non-FES patients had higher proportions of emergency room and general practice visits, while patients who underwent FES were more likely to visit an otolaryngologist. During the intervention period, costs per patient were approximately 10 times greater in the FES group compared with the non-FES group. Costs were similar between groups during follow-up. OCS and economic burden outcomes were assessed over 3 years post-index by sensitivity analysis. Minimal differences in cumulative OCS dose and costs were observed between FES versus non-FES patients in years 2 and 3. Overall, OCS burden in patients with CRS with NP was significantly lower, but remained substantial following FES, and healthcare resource utilization and costs during follow-up were similar to match patients without FES. This study demonstrates only marginal differences in costs up to 3 years post-surgery between matched patients who did or did not undergo FES. These findings highlight the need for more effective CRS with NP therapies. Thank you for your attention.